ripple starts with a force. In Massachusetts, it began with a question. How do we meet rural communities where they are, not where we expect them to be?
So my first connection to rural RVEI is that within that role that I have as division director, the State Office of Rural Health sits within the division as a whole. So that's my first connection to the program. I think the other ways that we relate, though, is really about how we think about the work and how we bring oftentimes the lens, and all of the programs within the division bring that lens and that knowledge and history of understanding how people are often marginalized by systems.
As the pandemic spread, the need became clear. The solution had to go beyond access. It had to repair trust, remove barriers, and recognize the history that shaped those barriers.
There was a real motivation within the Department of Public Health and the state as a whole to increase vaccine rates. And this understanding over time, Garen, of how to meet communities where they are and the different barriers that these communities face, an opportunity like we see in a rural vaccine equity initiative.
The team knew that information doesn't just flow through systems. It travels through people, through relationships, through trust.
Information is better received when you trust its source. There are people with social capital in communities all across the state. And once you tap into those people and tap into their networks and the communities of trust for which they work in, once you tap their knowledge of the community context that they're working in, it enables information to from trusted source to trusted source to trusted source.
To make that happen, her team had to advocate, not just for funding, but for a shift in mindset.
My team really advocated a lot for mobile vaccine vans. Well, and there was these conversations internally about we'll bring them here. We'll bring them to this one spot. I'm like, but that's not where the community gathers. Your numbers would be better here, where the community gathers.
The result? Proof of concept, and a model that could ripple far beyond this one moment.
Some of the highest vaccination rates in the state, in these rural communities. Just a proof that the model, investing in communities and our community partners, works.
This was never just about one vaccine. It was about equity in relationships, in process, in outcome. This is how systems begin to see us. This is the rural effect.